Hello, my name is Dr. Ghada Maghaire. I am the course coordinator of this course, Conservative Dentistry 1 and 2, Dent 445 and 446. This lecture will be an introduction to the course. The aim of this continuous course is to provide students with the fundamental knowledge of occlusion and produce students who are skilled on management of various clinical aspects in operative dentistry using different restorative materials including amalgam, resin composite, and glass ionomer, in addition to the management of simple cases of endodontics. The main textbook is Picard's Guide to Minimal Invasive Operative Dentistry, the 10th edition. In addition to the main text, there are also other textbooks that are mandatory during this course. For example, for the endo, Cohen's Pathways of the Pulp, and for the operative, we have two textbooks that you already covered during the third year, Fundamentals of Operative Dentistry and the Art and Science of Operative Dentistry. This course consists of about 12 lectures. I will give you 4 or 5 lectures of them, and also some of the staff, Dr. Ruba Mustafa, Dr. Ahmed Jum'a, and Dr. Ala Liqba will also help me in giving some of the lectures in this course. Assessment of this course will be divided into two parts, continuous assessment and final assessment. The continuous assessment, it has 40% of the total weight for marks, and the final assessment, it will have 60%. The continuous assessment is subdivided into course clinical work, which means the requirements all over the year, and it will consist of 20%, and multiple short answer online exam, which means the mid-term exam, and it will be after the end of the first semester, and it will also has a total of 20% of the total mark. The final assessment, it will have 60% of the total mark, and it also will subdivided into multiple short answer exam, which means the final exam at the end of the year. It has 40% of the total mark and 5 competencies which will be done throughout the year, and it has also 20% of the total weight. There is here a note about the competencies. Already we have 5 competencies, but you should note that you should do 2 competencies at least during the first semester. So please don't leave the whole competencies for the second semester. And also the competency, it's like an exam, which means you have to do it by your own, without the help of the instructor, and you should tell the instructor at the beginning of the clinic that you will do this as a competency, as an exam, okay? Regarding the clinical requirements, you should do 3 class 3, 2 class 4, 2 class 5, 1 class 1 composite, 3 class 2 composite, 1 class 1 amalgam, 2 class 2 amalgam, and 2 anterior and 2 premolar RCT during the year. And you have 5 competencies: 1 class 3, 1 class 2 composite, 1 class 2 amalgam, 1 access for a premolar, and 1 multiple isolation with rubber dam. As I said before, you should do 2 of the competencies at least during the first semester. And note that the competency will be evaluated like an exam. So you have to tell the instructor at the beginning of the clinic that you will do the exercise as a competency, and it will be graded accordingly. You should note that each step that you have done for the patient should be documented on the patient's electronic record, and if you didn't do that, then you will not have a grade for your work at the clinic. The instructor, after you finish the documentation, the instructor will go back to the patient's electronic record and approve your work and give you a mark to that work. Thank you.